Good evening. Thank you for watching. I'm Leah Hogg, and this is our update in English. We're taking a look at the Wimbledon Tennis Championships and Andy Murray's participation. Our guest joining us remotely by Skype today is Mr. Alistair, consultant orthopedic surgeon. Good evening, Mr. Patch.
Good evening, Leah. Thank you for the invitation.
Thank you very much. We're all sort of amazed watching Andy Murray. And thank you very much for joining us today to explain exactly what sort of condition was he suffering from.
Yes, so we're in the middle of a Wimbledon Championships. And as we know, Andy Murray, an ex-champion actually, suffers from hip condition. Hip arthritis, as we know, normally affects the elder generation, but it can affect younger patients too. And sadly, tennis, being a high energy and pivoting, twisting type of game, precipitates these kind of symptoms in patients who is prone to hip problems. Now, hip arthritis or wear and tear is actually a degeneration of the cartilage lining of any joint, but particularly hip too. When it affects young patients, such as Andy, there's normally underlying cause for this. There's a normal underlying anomaly, normally in the shape of the femur, which is the bone that makes the head of the hip joint. And these patients are born with a bump or a hump on the femur, which tends to impinge on the cup of the hip called the acetabulum. And what happens is that with the repetitive impingement, and they tend to get wear of the joint and the cartilage lining. And this is in fact what Andy had. He had been suffering for many years with this kind of impingement and cartilage loss in his joint. And this has caused him to lose a lot of his training and also to decrease his number of activity in tennis. And sadly, had to end up having two operations, in fact. The first operation was an arthroscopy, which was an intervention where they tried to clean up his joint and remove this debris and wear and tear and cartilage loss. But sadly, as this did not help, he ended up having a resurface replacement. Now, surface replacements are not commonly done, but they are a type of procedure where the lining of the hip is replaced by one made of metal. These replacements have been around for some time. They were developed initially in Birmingham in the UK. In fact, they are sometimes called the Birmingham replacements. They are ideal of young age Andy. Now, whilst in a resurfacing replacement, we just change the lining of the hip joint, but leave the actual bony structure there. In a total hip replacement, we actually remove all the bony structure of the hip and replace it with one made of metal and plastic. The advantage of using a resurface replacement is that it's more physiological to the patient. So we tend to preserve more bone in a resurfacing replacement. And also, because we are not removing the head itself, but resurfacing the head, it tends to be more stable, so the risk of instability and dislocation is low. And Andy Murray, being a young patient with good bony stock, is an ideal patient for this kind of surface replacement. As we know, hip replacements are artificial type of treatments, and anything artificial tends to have a lifespan. In fact, hip replacements only last about 10 to 15 years. The standard hip replacement, I mean. And after 10 to 15 years, they tend to fall apart. The cement in them may start to wear away, and they may start giving problems to the patient. The satisfaction rate from hip replacements in general is about 95 to 98%. Studies for resurfacing replacements, like the one Andy Murray had, show success rates of about 96% in 7 years. Obviously, one can imagine, since Andy Murray has had this resurfacing replacement, which we've spoken about, there's been increased interest, this type of replacement, and many patients are asking whether they are fit and whether they are candidates to have this replacement. As in all replacements, there are certain complications and risks that may happen. They are major operations.
Thank you, Mr. Patch, because we're actually losing you a bit. Just one final comment. What are your comments on medical innovation in this field? Very briefly.
So in the moment is done more at the arthroscopic level. We are trying to introduce arthroscopic hip arthroscopy, which can tackle arthritis and wear and tear in its early stages. In fact, nowadays we can enter the hip through keyhole surgery like we do in other joints. And if there's any signs of labral injuries or wear and tear or cartilage damage, we can actually try and resect it and clean out the joint before the patient will actually need any further major surgery like a hip replacement. We are also in the field of hip arthritis with the of technology, where we use stem cells from the patient, reduce them into our hips.
Thank you, Mr. Patch. Thank you very much. Thank you for your connection this evening. Thank you for joining us.
Thank you.
That was orthopedic surgeon Mr. Alistair Patch with a very thorough explanation.